On this video, you will learn how to deal with an unconscious casualty. Dealing with a sudden collapse can appear to be daunting, and a lot of people are very worried in case they do the wrong thing or they're not sure what to do. So the purpose of this film is to help you to sort out what our priorities are and what actions we need to take. Well, first of all, as with any first aid situation, you need to focus on what we call the primary survey. Primary survey is, as the name suggests, a way of dealing with the situation. It's the first thing that we do when we are faced with the situation. And the first thing we always do is to check for danger. Okay? When you have a person in a difficult situation, you want to make sure that the cause of that situation is not going to affect you, so you want to make yourself safe. Are they touching electrical cables, for instance? Can you smell fumes? Are there chemical spillages? Depending on the environment, have a look round just to make sure that the situation is safe for you to deal with. You're no use to them if you become harmed in any way. Once we've checked that out, the next thing we need to look at is the patient responsive? Well, we do that in a couple of ways. First of all, we can speak to them. If someone's lying down, we speak to them. Obviously, if they're just asleep, they will actually answer if we wake them up. But generally, we shout at them, use their name if you know it, or give them a tap or gently shake the shoulders to see if we can get any response. If we're not getting any response to either of those, then we are definitely dealing with someone who is actually unconscious. So now we have to consider other things. The primary survey consists of 4 sections. We've done the danger, we've checked response. The next thing we look at is the airway. Now, if a person is unconscious and they're on their back, there are several things to consider regarding a possible blocked airway. Are there any fluids in the mouth? Vomit, blood, excessive saliva? Is the tongue dropped back? The tongue's the biggest risk of all, because when a person's unconscious, as we all know, muscles do relax and the tongue will drop back and possibly block the airway, which is potentially life-threatening. So we need to consider these things. So for instance, if I look down at a person who's unconscious on their back and I see evidence of vomit or fluids trickling outside of their mouth, I do have to get rid of that. And the only way we can clear that is to literally grab the person, pull them over and let the fluids drain. Let gravity be our friend in this situation and pull the fluids away. Okay? If we have a situation where there's no evidence of any fluids, obviously we don't need to take that step. But the tongue's the biggest issue. The tongue can drop back. The expression that people use these days, you hear people say, well, they've swallowed their tongue. This is actually not true. You can't actually swallow your tongue because it's actually fastened to your jaw. But it does drop back and it does block the airway. There's a simple manoeuvre that we use to open the airway. It's called the head tilt chin lift. And we perform this by placing one hand on the forehead, 2 fingers on the chin, and tilting the head backwards. And as we lift the jaw, the tongue, which is attached to the jaw, will lift with it, and we can create a small space behind it to allow passage of air. Having opened the airway, the next thing we need to establish, of course, is the patient breathing. And we're looking now at what we call normal breathing. Normal breathing is quiet, it's not laboured, it's not difficult. So no gasping sounds, no laboured heavy breathing. We're looking for normal, quiet breathing. And we do this by putting our face down over their mouth, looking down the line of the chest to see if there's any movement, any rise and fall to indicate normal breathing. At this point, we can also feel the breath on our cheek and possibly listen for slight breath sounds. And we do this for up to 10 seconds. Having established that the person is breathing normally, the next thing we need to do is to place them in what we call the recovery position. This actually means simply turning them onto the side. And the reason we do this is, first of all, it will allow the tongue to move away from the back of the throat, therefore keeping the airway clear. If the person is sick, there's a greater chance that the fluids will drain rather than block the airway. And the third reason is it does actually improve the quality of breathing. When a person is lying down, they breathe better when placed on their side than they do on their back or on their front. Having placed the person into the recovery position, it's essential that we then keep them warm. And by that, I don't mean using things like hot water bottles or heat packs. I mean just general bodily heat by putting a blanket over them or a coat. We do need also to maintain the breathing, so we need to be constantly checking the breathing in this position. And of course, at that stage, we also need to consider calling 999 or 112 to get an ambulance to come and obviously sort the person out and take them to hospital. While we're waiting for the ambulance to arrive, just a couple of things we need to be aware of. First of all, constantly monitor the breathing, very important that. And secondly, don't assume that because the person is unconscious they can't hear. Hearing is the last sense that goes when a person becomes unconscious, and so still talk to them on the basis that they can hear and offer reassurance. It's very important and often overlooked this, but reassurance is in some cases is as good as any bandage. Just to recap, first of all, danger, response, airway, breathing. On the assumption that the patient's breathing, place them in the recovery position, monitor the breathing, call for an ambulance and stay with the person until the ambulance arrives. So thank you for watching this video. I hope you found it useful and I'll see you again soon.